Hi, everyone. Welcome to the Mama Doc Baby Doc podcast. I'm Rachel.
And I'm Brenda. Welcome, everyone. We're so glad that you've joined us for episode 2 of Mama Doc Baby Doc. This is the podcast that gives practical, evidence-based advice and information on all topics related to pregnancy, childbirth, and raising children.
Yep, and in this episode, we're going to talk about everything you need to do to prepare for your big day, the delivery of your baby.
And your big day is coming up soon, Rachel. Are you excited?
I am excited. I'm nervous too. I'm both. I'm all the things.
Yeah. You're almost 36 weeks now. Is that right?
Yep, on Tuesday, I'll be 36 weeks.
Wow. And how are you feeling? How have you been feeling lately?
I've been better. I feel huge. I feel like a house. I waddle. I have such bad back pain. Like my whole back's on fire all the time. And It makes it so I can't sleep. I'm like constantly rolling and moaning and whining all night.
I'll bet John enjoys that.
No, he's like, I didn't sleep good last night. I wonder why. And I'm like getting up to go pee every couple hours. But I mean, I haven't had like some of the symptoms like heartburn and things like that That's people good. Say are really bad. So I'm doing okay. I'm still working. I'm planning on working until the day of. So we'll see.
Wow. Well, are you getting nervous about your delivery?
I'm a little nervous. I'm not like horribly nervous though. I think though I'm not super nervous because I don't really know what to expect. I don't know what to be nervous about because this is the first time having a baby. And like we said in the last episode, like, you know, it's so different when it's you and not like a patient that you are taking care of.
Right.
So I don't really know what to expect. So I don't know.
Well, do you feel like you're ready? I mean, what kind of things are you doing to get ready? Have you been getting ready?
Well, I put a lot of time into getting the baby stuff ready. Like we had a baby shower and we got so many clothes. His closet is like full. He has
I saw his closet. I think it's he has more clothes than I do. Yeah.
He does. He has more clothes than me for sure. You know, I've been washing them in the baby laundry detergent and we got a crib and we got to put it together still, but we do have one. But I've got all his things together. But
and what about your things?
No idea.
Yeah. Are you
Go ahead. I have no idea. Yeah, for like they all talk about like pack your hospital bag and I'm like, I don't know what to do it for that. I've just been trying to do some research online, and that I mean like Instagram and Facebook research. And one thing, I actually have one thing right here everyone recommends is like this upside down Peri bottle by Freedom Mom. Because they apparently they give you one in the hospital, but this one, the end is kind of like goes up instead of down, so you can hold it like normal and you don't have to like bend your arm in a weird way.
A contortionist.
Yeah.
That's awesome. Okay.
So I don't know if it's like necessary, but I don't know. I'll let you know.
Great. Well, have you thought about your birth plan yet?
I know everyone talks about birth plans and their opinions on what should be on their birth plan. I don't know what even to put on there, what I should, what I shouldn't, what's realistic, what's not realistic. I think what I have right now is give me an epidural, and that's it.
That's great. That's a good start. We're going to talk about birth plans in this episode. So, every time I see a birth plan as an OBGYN physician, a patient brings me the birth plan. Every time I see a birth plan, I do laugh a little bit inside because births rarely go as planned. And I always say, as long as when we're done, we have a healthy baby and a healthy mom, then it's been a successful birth. And that's kind of my way to judge if the birth is successful.
Yeah, I mean, yeah, exactly. I think that's on everyone's birth plan, right? Like healthy
Right.
baby, healthy mom, get the baby out.
Right.
That's it.
Right.
Yeah, some of the like blogs and Instagram posts that I'm seeing are like, oh, all you have to do is relax and the baby will just come out. Just do meditations, visualize your cervix opening, and relax, and the baby will just come out. It will be fine. Just trust your body. Your body knows exactly what to do. And I'm like, oh my gosh, does it though?
Well, there is some truth to that. There's no question that meditation, relaxation, and being calm are super important. And, I've definitely had patients that were so tense and they couldn't relax.
Yeah, I think it would be hard to relax in that situation.
Yeah.
I don't think that's an easy thing.
Right. But when you're so stressed and uptight, you can actually hold your baby in. And for some of my patients, they were doing that. Like they'll hold their baby in because they're so tense and uptight. And a lot of times when that happens, if those patients get an epidural, after they do, they relax. And then guess what? Baby can come down, can descend into the birth canal. So, being tense and uptight is not good. Not good for baby coming out anyway. Yeah.
Yeah, I think I know that the people who talk about, just relax and meditate are, they have great intentions, but I know that if you end up having to have a C-section or if you end up not being able to relax and get the baby out, then it makes you feel like you did something wrong. You weren't relaxed enough. And I think it's really important to not make anyone feel like it's their fault or they did anything wrong.
Absolutely. Absolutely. I agree. Things happen. Births do not always go the way we want them to go. And that's why you need to have a doctor that you trust. And that's why it's important to think through what you want and what things are important to you.
Yeah, I really probably should start thinking about my birth plan too.
Well, when I was pregnant with you, Rachel, I had no plan. Literally. I mean, I was 22 years old. I was clueless. I had no idea what I was in for or what to expect. And maybe I just thought I would go to the hospital and pick up a baby. Like I literally didn't have a clue. I remember the day before you were born, I woke up feeling really bad. And I wasn't sure why, but I hadn't slept well that night. And I just felt like there was something wrong. Well, in retrospect, I was probably in early labor then, but didn't even know it. So that day I made an appointment. I went to see my doctor and he told me just to stay home from work and rest. So I was only 36 weeks pregnant. And that's how far along you are now, I think.
Yeah. I mean, even me, I was telling John today, my back's hurting so bad. I don't know if this is the contraction. I don't even know what I'm looking for or feeling for. You just don't know.
Right.
If you haven't been through it, you don't.
That's right. And I was clueless like that. So, I mean, I didn't listen to my doctor. I went to work. Back then I worked 3 to 11. I was working at the Medical College of Ohio in Toledo, Ohio. We were starting this brand new thing called electronic medical records. That's funny because now all medical records are all on the computer. But anyway, we were just going to start it, and it was really cool new thing. Anyway, I was miserable that day. I worked my entire shift, and then I finally got off and went home. And it was after midnight before I got home. And I was just getting into bed. I really lifted my leg to climb into bed, and my water broke. But I didn't know that it was my water breaking. I thought I peed on myself. And I was a little bit mortified. So I went in and took a shower. And then I got out of the shower. And whenever I would walk, a little bit more would come out. And I thought I kept peeing on myself. Literally, I think it was at least 20 minutes before it even dawned on me or even crossed my mind that it could be my water broken. That's how clueless I was. And then when I thought, oh my gosh, is my water broken? I panicked, right? So I woke my husband and we did the crazy mad dash to pack the things that I might need because like you, I did not have my hospital bag packed. So we were running around the house, grabbing a toothbrush, grabbing stuff that I didn't even know what I would need. And then we raced to the hospital, and the hospital was a 30-minute drive from our house. So it was a little bit of a way to get there. And on the way to the hospital, that's when my contractions kicked in. And they were really hurting. So I started crying. And it was after 2:00 in the morning when we got there. And I remember your dad was so frantic. Like he jumped out of the car and ran inside, grabbed a wheelchair, and then pushed me in, yelling, "Help! My wife's in labor! Help!"
It's like something out of the movies or something.
Right? It was just like a movie. So then when the lady checking us in realized it was my first baby, she gave us the look. She was not amused. And she made him sit down and fill out all the paperwork. But we were panicking. I think we thought the baby was just going to come out. Well, you and I both know that first labors last usually like 12 hours or maybe more. So we had plenty of time, but, I really just didn't know. So finally we got to a labor room and in a bed and the monitor, and yes, and I was in labor, and yes, my water was broken. And I remember at that point, the labor pains were just so intense. And I kind of zoned out. I was exhausted. I'd worked, hadn't slept the night before, and then I worked all day. So I would like fall asleep between contractions, and then I would wake up and cry during the contraction. And back then, they did not offer any pain meds or an epidural. And I didn't even ask for anything because honestly, I didn't even know what my options were because I was truly clueless. Yeah.
I think that's the one thing I do know. When I walk in, I want an epidural.
That's pretty
My
smart.
husband, John, he is a CRNA, so he does epidurals all the time. And he tells me stories all the time how women wait until it's too late and then they ask for them and then they don't have the opportunity to get one. So I do know that. That's the one thing I know. As when I walk in, I'm going to say I want an epidural.
Get you that epidural. Well, about 5:00 in the morning, so a couple hours later, I started to feel this weird kind of pressure. And then the nurse came in and told me to stop pushing, that it wasn't time. But I didn't think I was pushing, but apparently I was. And then she checked me, and guess what? It was time, except the doctor was still at home in bed because it's 5 a.m. Great. So they called the doctor in, and they kept telling me not to push, which was super hard. And then the doctor finally got there, and then they told me to push. But when I did, I felt like I was going to have a bowel movement, so I didn't want to push. But I wasn't going to poop. It was actually your head. So at this point, I think you were starting to crown, and it was so intense, the burning and the pain. And I saw my doctor, he's down there and all my stuff. And he grabbed a syringe and a needle. And I think I almost screamed, but instead I just sucked in air like that. And then he injected the medicine in my perineum, and I hadn't expected that. I didn't know that was going to happen. So then I relaxed thinking, oh, that's it. Okay. He was just getting me numb. But then he grabbed a pair of scissors. And before I could scream or protest or say anything, snip, an episiotomy.
Oh my gosh.
And I honestly did not even know that was a thing. And back then it was pretty routine and nobody had told me about it. I was shocked. It was actually horrifying.
Yeah, that's awful. I would not have been very happy.
But then you were out and you came out and they took you over to the warmer, and I heard you cry and I forgot all about my bottom. I just kept looking at the warmer, trying to see you. And then he started stitching me up, and I remember that too. It just was so weird. It was very surreal. Back then they took the babies away. We didn't know that skin to skin is what's best for baby, right?
Yeah.
So after a while, I did get to hold you for a few minutes. They wrapped you all up in a blanket and they brought you over, and I got to hold you, and you were so beautiful. You had, even then, even with that big head, you had the biggest head of any baby I have ever seen, even to this day. You were perfect, Rachel. You were so perfect. And after
I still have a
about,
pretty big head. It's
you have
okay.
a really big head, yes. But after about 15 to 20 minutes of holding you, they took you to the nursery and told me to go to sleep. And I was exhausted, so I did. No one even mentioned
Yeah.
breastfeeding. They just took you to the nursery and they gave you a bottle. Yeah. Well, a few hours later, they came back to my room and woke me up, and they told me that you were having trouble breathing, but you were in the nursery and I didn't get to see you. And then a few minutes later, like 15 minutes later, the pediatrician came in and told me they were going to ship you to Akron Children's Hospital because you were sick. So I got up out of bed and started packing. And then the nurse came in and said, "Oh, but you can't go. You just delivered a baby. You have to stay here." So
Oh no.
I said, "No, I'm going." And, back then they didn't put me in the helicopter with you. No, they just flew you away.
Yeah.
So I left. I had to sign a paper saying I was signing out against medical advice. We drove,
Oh my
got in a
gosh.
car and drove to Akron, Ohio, which was an hour and a half drive to get there.
After you had just had a baby.
After I just had a baby and not slept in 2 nights. And the rest is history because you obviously recovered. You ended up, you had GBS sepsis because back then we didn't test for beta strep, right? Now, all pregnant women, it's standard of care to get tested for GBS in the 3rd trimester. And that way, if you do have it, you get antibiotics in labor to protect your baby from having GBS sepsis, which is what you had. So many things about my delivery were just shocking and unexpected. But yeah.
Yeah, but look, here I am. You got me.
That was my bonus prize, right? But thankfully, the practice of medicine and delivering babies has changed so much since then. I mean, we no longer do routine episiotomies. We let the cord pulsate before we cut it. We know the benefits of immediate skin-to-skin contact for baby, and we actually involve patients in decision making now, which is really a great advantage. Yeah.
I think just you talking about that makes it really clear why it's so important to be educated about the things that go on during a delivery, the things that could happen, the things that maybe you wouldn't expect. Like in episiotomy, you don't want to have to do that and not know what's going on. That sounds horrible. And why it's important to have a birth plan and talk about it with your doctor or midwife. Yeah, for sure.
Right. Yeah. I mean, the day you give birth is one of the most important days of your life, right? I mean, I still remember so many things about that day, and it's been how long? 36 years. But it's still one of the most important days of my life. So creating your birth plan ahead of time really helps you make decisions about how you want your labor and delivery to go. And it lets others know what your wishes are so that when the big day arrives, you can just focus on what's important, bringing your new baby into the world, right?
Yeah. So for a birth plan, there are things that I know should be in there, like who you want with you in the delivery room, whether you want an epidural or not. I know I want one. If you want the lights dimmed. I remember a patient who had wanted the lights dimmed and not a lot of talking, a lot of noise, that type of thing. If you want dad to cut the cord, if that's super important to you. I know those things, things that will make you more comfortable. Or if you want a playlist, a push it playlist or something.
Right. Yeah. Push it really good. Right.
Yeah, exactly. But I also know, just as many deliveries as I've seen and been a part of, even, in pediatrics, because we stand in the resuscitation room and we get to be a part of a lot of deliveries too, that way that it's not always set in stone. It doesn't go the way that you planned. And I do know that being flexible is very important because you can't predict a lot of things, and ultimately end goal should be healthy baby, healthy mom. But what kind of things have you seen in birth plans what kind of things do you like to see in them?
Right.
What's helpful for you?
Yeah, well, your birth plan should first of all start with the basic things like your name and your contact information and who you want to have in the room with you at birth. And that's important. So, Rachel, when you're writing your birth plan, you make sure you put my name down as somebody allowed to be in the room for your delivery.
Oh, don't worry. You're going to be there.
I'll be there too, but seriously.
Don't worry.
And this can protect you. If you do have a mother or mother-in-law who might be overstepping and wanting to come in on your birth and you might not want them there, you can have them use the nursing staff to tell them they're not allowed to be there. They can help you if you want that protection. But Rachel, don't even think about it. That's think about the atmosphere. What are you going to feel most comfortable with? Like the dimmed lights, keep the room quiet, or play music. Some people now use essential oils. And do you want people to take photos or videos during your delivery? Then the actual labor process. Some people want to be able to walk around. Some people want to use a birthing stool or a birthing ball or a birthing chair. I found that some people they want to be up walking around during labor, but then when they're actually in labor, it hurts so bad they don't want to get out of bed. So it can change, right? But just start thinking about what kind of things you can ask for. Because if you don't ask for a birthing ball, they may not offer it to you. But if you ask for one, they might bring it for you, or they'll probably have it for you. Things like, do you want a shower or a warm bath? Some hospitals and birth centers have birthing tubs now. I know we do at our hospital. And a lot of women, even if you don't want to deliver in the tub, you might still find that warm bath can be relaxing during labor and really help you get through labor easier. And yes, Rachel, you want to put what you want for pain control. You may plan not to have an epidural. Some women say that they don't want an epidural. And even if you put that on your birth plan, you can still change your mind. You may know that you definitely do want an epidural, like Rachel, right?
Yes, for sure. I'm a baby when it comes to pain. So I know that I want one for sure. But I know, I have friends who didn't want one. They wanted to do it naturally. They felt like, maybe having an epidural might prolong the process because you can't feel to push. And so they definitely knew that they didn't want one. I'm okay. For me, I'd rather be in pain than I'd rather not be in pain. Than right for 4 hours than be in pain for 1 hour because I'm a baby.
Right.
And I think that's okay. Everyone can make their own decision. That's what's
absolutely
important.
Absolutely. And I do find a lot that if labor progresses normally and quickly, a lot of women can make it through labor and delivery without an epidural. But sometimes labor is protracted, lasts a really long time and gets drawn out. And then you just get exhausted. It gets a lot harder to not get the epidural if your labor is really protracted. Another thing to think about is, do you want your nurses or your doctor to offer you pain meds or an epidural? Because a lot of people, they say that they don't want one, but then do they want the nurse or doctor to offer it? Some patients don't even want me to suggest or offer any type of pain relief. And if that's the case, of course I won't, because they know what's available. Other things that can help with the discomfort and pain of being in labor is a back massage. Have your partner give you a massage. Some women like to have warm blankets. It's comforting. And other women like cool cloths on their head. Deep breathing, meditation, those can all be really helpful things. Back when I was having babies, there was Lamaze class where you learned how to breathe during labor. But the main thing is you should all ask your doctor about what options are available for pain relief. We have IV pain medications that can help, but we don't like to give those when it's close to the time of delivery, right? Because they can affect the baby's breathing if they're, yeah.
I've seen that in real life, where it was given too close to delivery because it was emergent, and then the baby had trouble breathing.
Right.
But, I think another really important thing is, don't judge yourself. If you end up wanting an epidural at the last second, don't make yourself feel bad for that. You've got to listen to your body and,
that's right.
and do what's best for you.
Right. Absolutely. Yeah. you get the same baby whether you get the epidural or not, and you still get the star for having the delivery, right? Whether it
Right.
is unmedicated or medicated. Now, our hospital
Yeah.
also offers nitrous oxide, which is laughing gas, and that's available to help with pain too. So yeah, you're laughing now.
I know, because it'll be funny.
Yeah. It works really well to help people relax. I think the nitrous oxide doesn't actually take the pain away, but it makes it so you don't really care. You're happy. Yeah. And that
I'm sure those are fun deliveries.
They are. But nitrous oxide does not affect the baby. So it's really very safe to use. So talk with your doctor.
Interesting. I've never seen that. Yeah, that's cool.
Yeah. The epidural works much better though for pain relief, but talk to your doctor and see what options are out there. Yeah.
And then, I have seen one delivery too where for the birth itself, some women want a mirror so that down there so they can actually see the delivery themselves, see the baby crowning.
Right.
I also have a friend who does. Yeah, I have a friend who has done the perineal massages and oils to help it stretch down there to make it easier.
Right. Easier for baby to come out,
yeah,
right?
Skin to skin. Yeah. All those things I think is important for a birth plan.
Right. And then the fact about does your partner want to cut the cord or not, that's a really good one, because so many times I've had birth plans where the dad says they want to cut the cord, and then when the baby's actually born, they're so overcome with emotions that they change their mind and say, no, you do it. And then there are other dads,
I've seen that too.
Yeah. And then there are other dads, they say they don't want to cut the cord, no way. But in the moment when it's time to cut the cord, I always still offer them the scissors. And it's not uncommon for them to change their mind and decide that they do want to, because they just experienced this beautiful birth and they are okay with it then.
Yeah, I have seen some dads back away like, no, I don't want to hurt the baby.
Right. It doesn't hurt them.
Cute.
It does not hurt them. Yeah. So, there also are a lot of women that already know they're having a cesarean section. Maybe their baby's breech, or maybe they've had a C-section before. And if you're having a planned cesarean section, you know what? You can still have a birth plan, right? You can decide what kind of music you want playing in the delivery room. You can decide maybe you want to limit the number of hospital staff in the room or have them keep the room quiet. You can still put down who you want to be with you in the delivery and if they're going to take photos and videos. And guess what? You can still do skin to skin. You can still do skin to skin in the delivery room, in the operating room. You can even breastfeed in the operating room while the doctor is finishing up the C-section. So, birth plans are also important for our C-section moms, right?
Yeah, I've even been one of the hospitals I worked at, you had to have the baby go into the resuscitation room after every C-section, but we did everything so quickly in there and got the baby right back to the mom as quick as we could. And she was able to do skin to skin and take the baby back with her to the recovery room as well. So, and then we didn't bother them in the recovery room. So yeah, you can make all those decisions and make it really well known what you want. Yeah. But another thing you need to think about too is feeding and baby care. Right. Do you want to breastfeed the baby right after delivery, or do you want to bottle feed the baby? Do you want to do breast and bottle? How do you want to feed your baby? Do you want your baby to be kept in the hospital room with you for the whole time? Or, no judgment. Some moms want their babies to go to the nursery so they can take a nap. And no nurses judge them for that. They get it. We all understand. Right. You just went through something, exhausting. Get your rest while you're in the hospital. That's fine too. But also thinking about, do you want your baby to have a pacifier? Some moms feel really strongly that they don't. And it's really important to tell the staff, especially that type of information, because they might come back from the nursery with the pacifier and you don't want to be upset. So just make sure everyone knows what you want. And then also circumcisions, right? If your baby's a boy, do you want him circumcised? And if so, do you want him to have Normally we give sugar water. It's called Sweeties. It's just sugar and water. It kind of helps with calm them down for the procedure. They also give lidocaine as well, but the sugar water helps too.
I think it would help me too.
Well, me too.
Yeah, and also
you want to know all that.
And there's a bunch of tests that are done on newborns, and talk a little bit about that.
Yeah, so there's a bunch of tests. There's the newborn state screen, the metabolic state screen. It's a little heel poke. They get some blood and it's sent off to the state to test for congenital diseases. Some states just do it 24 hours after birth. Some, like where I live in Colorado now, they have to have one 24 hours and then one 14 days after delivery. Oh, wow. So every state's a little different. There's the congenital heart disease screening where that's not invasive at all. It's just they do put a little sticker on the arm, a little sticker on the foot of the baby, and check the oxygen saturation. It's a screening to see for congenital heart diseases. Also, standard practice is every baby gets erythromycin eye ointment to protect against gonorrhea and chlamydia, eye diseases that babies can get from being delivered. Hepatitis B vaccine is standard practice in newborns, vitamin K injection as well, and the hearing screen. So those are all things you can expect. We'll probably talk about them a little more in depth in another episode, but just talk to your doctor and make sure you know what tests and treatments are, routine in the hospital you're going to be giving at, and learn about them. Like, why do we do the vitamin K shot? Why do we do the hepatitis B vaccine at birth? That's a question I get so frequently. If I screened negative for hepatitis B, why is my baby getting the shot? So talk to your doctor about it. We'll talk about it too in another episode, but you just want to have all the information. That way you can make the best decision for your baby.
That's perfect. So when you have your birth plan all set, then you want to review your birth plan with your partner and anybody else who's going to be with you in the labor room, like your mom, Rachel. And also, you should always also ask your doctor to take a look at it. You need to discuss it, not just give them a copy and have them put it on your chart, but actually discuss it. Go through it with your doctor in detail so that you can get their advice and their opinions too, right?
Yeah, should that be done like prior to going to the hospital to give birth?
Yes,
like
it should.
Maybe the appointment before?
Or one of your prenatal visits, right? Definitely by about 36 weeks, Rachel, you should review your birth plan with your doctor.
Okay. I'll get to that.
Okay. And, reviewing it ahead of time, it gives you time to resolve any potential conflicts or concerns, and you kind of get to know what their feeling is about all of your ideas and plans and what you want. And once your birth plan is set, then you give a copy of it to your doctor, and you also take a copy to the hospital or the birthing center where you're going to give birth so that they can keep it there on your chart also.
Yeah, I've seen a bunch of things online as well about giving a copy to your partner, your husband, or a significant other who's going to be with you at the hospital. Just so that way, if for some reason something happens to you and you can't express like your wishes,
absolutely,
that he knows everything or she knows everything.
Right. Yeah. And if by chance another doctor winds up delivering your baby, they also are going to need to know your preferences, right? I mean, it's not necessary for your birth plan to have all these preferences listed out, but you can also decide or even change your mind about certain things when you're at the hospital. And that happens all the time, but it's important to have them at least listed, right?
Okay, so I think I need to get started on making one of these things. But it's good information, and I really don't want to be clueless and in the dark, like you were going into yours. So.
Well, hopefully you all will find this information helps you prepare better for your big day. And I do hope and pray that everything on your plan goes exactly as planned, Rachel. But if it doesn't, just stay flexible. And I cannot wait to meet baby JJ.
Yeah, me too. You joke so much about, I have to be on your birth plan, but I invited you. Don't
I
make
know
these
you
people
did.
think
I
that
know
you're
you did.
pushing your way in. I told you have to
I
be
know.
there.
I know.
I'm not
I'm
doing this
invited.
without you. But
Yay.
anyways, that's it for today's episode. I hope that you found it as helpful as really I did, honestly. And I'm glad that you joined us. We'll see you next
Yay.
time. Bye.
Yay. Bye.